As the mental struggles are difficult, athletes with past injuries continue to suffer after their playing days are over.
We see Harris going off right tackle and behind perfect blocking, break into the clear.
Stan Irvin played football for Colorado from 1961 to 1964. Stan was on the All-Conference team and drafted by the Kansas City Chiefs in the 1965 AFL Draft. He chose not to play professionally due to existing knee and shoulder injuries. Stan went into the Army Reserves and has since worked in a variety of fields from carpentry to oil rigs over the last 40 years.
All right, go outside. I remember the first thing they told me when I came in as a freshman, our first meeting is, don't believe the men in white and sustain the pain. They were fairly abusive. They ran a lot of drills where they would take freshman ends and run them across the middle and let the linebacker knock the crap out of them.
I mean, you don't see nearly as many golfers when they realize, oh, you know, my college golf career, I'm done. They're not having the kind of problems that football players are. It's a tragedy on a lot of levels.
Miguel Rueda is the director of sports medicine for Colorado Athletics. Miguel and his staff are working to improve the care given to student athletes during their time in competition at the university.
Our number one charge with student athletes here is their health and safety. Try to explain to them and let them know that there's a risk in competing in athletics. Things happen. It may not necessarily be anyone's fault, but there's always a risk in competing.
Say what you want about other things, but in terms of team sports, might be the most dangerous sport in the entire world. For linemen, each individual hit at the line of scrimmage was like a 35-mile-per-hour car crash.
If a student athlete is getting to a point where they have injuries that may affect them for the rest of their lives, we really like to educate them and then come to a decision if it's best for them to continue to participate or not.
They're kind of trained to say, well, I'm fine, but yet their symptoms are saying, I'm not fine. So that's something too that I want to see us continue to work on, talk about, and address.
When they are done here, we then like to go back and give them an exit physical. So we go through their medical history with them and ask them questions, basically trying to get them to communicate about their injuries and if they have any questions. We always want to make sure that the student athlete is put in a position where they can be successful later on in life as an individual.
As the NCAA and universities are becoming more aware of post-competition shortcomings for former football players, an effort is being made to take better care of athletes as a whole.
I think there's been a big shift. And I think the basis of it is that recently mental health and medical health, there is parity. You cannot deny someone treatment for psychological or mental health.
Dr. Stephen Walker is a sports psychologist based out of Niwot, Colorado. Dr. Walker works with several collegiate and professional athletes.
There's good support for student life amongst the intercollegiate athletes at the university, and they need that because it's a tough go.
At one point, students were really commodities. We brought them in, we pushed them out. And now it's a much more sort of engagement that we want to make sure that they're successful long term.
Dave Callan is the director of the STEPS program for Colorado Athletics, a program that prepares student athletes for their lives after competition.
STEPS is an acronym for Success Training and Excellence Planning for students, for seniors to help with transition out of the University of Colorado. It's about connections to make sure that as they leave the university and they go home or whatever it might be, there's always some folks there.